Guys, good afternoon, everyone. Welcome in the How to Become a Fellow presentation from the Academy of Medical Educators. My name is Dr. Philip Zhu, and I'm one of the co-chairs of the Academy's membership committee, and I'm thrilled to be your host for today's session. And today we have with us Jody, who's one of the key linchpins of the Academy, one of the administrative officers, and we also have Professor John Sanders, who's the chair of the assessment committee. We also have Professor Nick Cooper, who's the president of the Academy as well. And Nick, I'm just going to hand over to yourself just to share a bit more about your background and the Academy.
Okay, thanks very much, Phil, and welcome to everyone. And grateful so many of you turned up at this time of the day and from overseas, etc. And hopefully it'll be a very interesting webinar. We're really reliant on the membership of the Academy to, improve what the Academy can do for medical education. And certainly, I think for most of us in the UK at the moment, medical education is at a huge crossroads with the expansion of medical schools, the need for increasing postgraduate training in a very challenging environment. So I think we need more educators than ever and more support for educators. And I think, the main aim in the Academy over the last 17 years has been to enhance patient care through education and training. And that's for doctors, dentists, physician associates, and veterinary students as well, and veterinary educators. So we have a very broad reach. We have an increasing membership, as Phil, I'm sure will explain. My background initially was in pediatrics and in general practice, and I've been involved in academic side of medical education for the last 20 years. And I think the Academy has a real key role, not only in helping to shape policy, which I think, again, is very important at the moment with our change of government and seeing all that's going on, but we have a voice at the table. And to help that, we have the professional standards, which I'm sure Phil's going to talk about, in terms of we are the only organisation that has that ability to provide professional recognition for your role as a medical educator. And we now have a public professional register, which is recognised by the GMC as providing evidence of your sort of good standing as an educator.
Nick, do you mind if you just speak up a little bit, if that's okay, or bring the mic a bit closer, just for some of the members here?
Sorry, the mic's on this computer for some reason. Is that better? Can people hear me better now? Any better?
It's slightly louder that I can hear you. Someone says maybe it's not as loud as it could be.
Any better? Any better? I haven't got a personal mic on this one.
No. Not ideal from some of the members here.
Sorry about that. That's the maximum I think I can do it at the moment. So okay. Rabbit says voice is okay. Mm-hmm. I won't repeat all that I've said. In view of that, what I'll say is welcome everybody, which I think is going to be a very interesting webinar. I think it's important that we support members and fellows of the Academy because they're the lifeblood of the Academy as we go forward, and you have a real role to play in the future support for medical educators. So if I hand over to you, Phil.
Perfect. Thank you. Thank you very much, Nick. And again, I'm going to reiterate some of Nick's points throughout the rest of the webinar, including some of the key points about the Academy. Today, we're also very fortunate to be joined by Professor John Sanders, who I'm just going to ask to introduce himself, because we're all passionate about supporting our members, as Nick said, through the journey towards fellowship and help really showcase your own achievements and your own expertise within medical education. Over to you, John.
Okay, thanks very much, Phil. My name's John Sanders. I'm Professor of Medical Education at Edge Hill University, and by background, I was a GP for 30 odd years. My particular interest has been reflective practice, but in my role for the Academy, I'm the lead assessor. Hopefully what I can talk about is about the importance of reflection and the importance of demonstrating reflection so that you can actually maximize the opportunity to showcase how your thoughts, values, beliefs, practice align to the core values of the Academy and also the standards. And I'll be talking about that a little bit later.
Perfect. Thank you very much, John. And we will have a dedicated Q&A session with Professor Sandars, who will be happy to address any questions you may have later on about the application process itself. So in terms of the objectives really for today's webinar, what we want to do is I want to explain the professional standards and the criteria that's established by the Academy and help you guide you through the application process step by step. I'd want to perhaps give you some examples of reflection within the educational practice towards the end of the webinar, which will help you understand how to articulate, how to go through, how to present your achievements within the application itself, and also the Q&A session at the end as well. Now, one thing that would be useful is to really find out by reflecting on the motivation of actually joining the Academy itself. And we've seen from the poll around 50%, probably more than 50% of the webinar members here are not actually members. So welcome to this webinar, because this is a very important question, because the motivation to join the Academy can set the foundation for your journey towards fellowship. And you may recognize some familiar reasons listed here already, because you may have seen the Academy as a specific way to advance your career. You may be looking for professional recognition of your contribution to the field, so which may include postnominals. So for both membership and fellowship, the MACAD MED and the FA CAD MED as well, respectively. And others may be encouraged by fellow colleagues or friends or even their own line managers who's recognized your own potential and recommended on joining the Academy to further your own progress. And for those of you working in the UK, by being a member or a fellow, it may contribute towards your education supervisor or clinical supervisor recognition within your local trust as well. And then obviously, ultimately, some of you will have been driven by a personal or educational curiosity, such as the desire to challenge yourself and broaden your reach. It doesn't matter what your reason is for becoming a fellow or joining the Academy. What's important is that you've taken a very important step in your professional development as a medical educator by being here today. Now, considering the next step and the application for fellowship. And this really is quite an interesting and an exciting decision to make. And it's important to understand some of the exact motivations there. Sometimes people see fellowship as a natural progression, logical progression in your career as a medical educator up from membership if you're already a member of the Academy already. Sometimes we have educators who want to reaffirm your commitment within the field of medical education and want to demonstrate your dedication. Certainly, what is true is the fact that you do get a lot of opportunities within career development and advancement by being a member as well as a fellow. And certainly, by having feedback along your progression or professional progress as an educator, you certainly can get a snapshot of that through the assessment stages. And hopefully that can help identify areas of growth and improvement during your self-reflection journey. And sometimes people do say that they may have found the membership application rewarding and useful by having an introspective look through their whole career and their achievements. And perhaps you want to continue that through your journey of self-reflection and own professional development as well. And for some, you may want to get more involved within the medical education community and contribute to the network. And certainly some may want to align yourself within the values and the goals of the Academy itself and to support its own efforts to promote excellence within medical education. And I'll go through some of the main things, the main roles, as Nick has previously mentioned, within the Academy to promote medical education as a professional career. So the Academy contributes to several key areas. Accreditation, it sets the standard. It provides professional accreditation for medical education application programs, ensuring high quality training for educators. It does a lot for revalidation. Membership and fellowship in the academy can serve as good evidence for your ongoing professional development and also your own commitment as well. Job planning and career progression, it provides guidance. There are resources to help plan your career within medical education to advance to higher levels of responsibility and leadership as well. And through its other programs, events, and resources, the Academy will help support your continuous professional and own personal growth as an educator too. And also within the side of it, as Nick mentioned, there are lobbying. So the Academy advocates for the interests of medical educators and works to really influence policy at a very high level at the national level. And as a member and as a fellow of the Academy, you will have access to a wide network of medical educators, both here in the UK and also internationally as well. And that provides ample opportunities for you to collaborate, for you to share knowledge and professional support as well. And we do promote and we do support educational scholarship, and we do try and encourage members to engage in further things such as research, dissemination of best practices within medical education too. And I think before we go into the application process, I just want to take a quick snapshot of some of the key facts about the Academy. And some of this may be familiar to you if you are already a member. The Academy was founded in 2006 with the express mission of advancing medical education and promoting excellence in the field. It is a registered charity and a company limited by guarantee operating on a not-for-profit basis. And the Academy is governed by an elected president, who is Nick, who we heard earlier today, and the council, and who serve as the board of directors and trustees. And it's the first organization to offer a registrable qualification and professional accreditation for medical educators based on a set of nationally agreed standards. And within the Academy, we have a diverse membership of well over 1,400 individuals, and we have them across a wide range of disciplines. And also we have those that are based in the UK, but as you can see from the chat box, we have a growing contingent of an international presence as well. And we heard people here from Ireland, Myanmar, and Pakistan as well. And the Academy is headquartered within Cardiff, thanks to the generous support of the local medical school as well. Now, at its core, the Academy is a charitable organization, is dedicated to advancing medical education for the benefit of the public. And it does so through two key areas of focus: the development of the professional standard framework, which I will stress again because that's quite important for the application process and your knowledge of this. And the Academy has established a rather comprehensive set of professional standards that can define the knowledge, the skills, and the values expected of educators at different stages in their career. And these standards form the basis for the Academy's membership categories and provide a good framework for your own professional development and recognition. And the second basis is the promotion and dissemination of the best practice within medical education. And that means the Academy actively works to identify, promote, and share effective approaches within medical education. And that can be achieved through different means: conferences, workshops, publications, and other online resources as well. There are different categories within the Academy, and I want to focus on the fellowship category for now, for this purpose of the webinar. The fellowship of the Academy, it really is designed for educators who have established themselves in the field and made a significant contribution to medical education. And certainly applicants for fellowship criteria should demonstrate a broad range of achievements or within the areas of medical education. And they could well be into their careers, and they might have a track record of excellence within teaching, within leadership, and or scholarship as well. Now, the Academy's professional standards are really underpinned by the four core values of the Academy that defines the ethos and the guiding principles. And you can see in the picture here, the four core principles is listed here, and it's surrounded by the 5 domains that you can see in color. Now, every fellow will have to write a reflective piece in their application process, demonstrating that they embrace the core values in their practice as medical educators themselves. And let's go through them. So number one, promoting quality and safety of care. So medical educators, you have a responsibility, and we have a responsibility to ensure that our teaching, our leadership activities contribute to the delivery of really high quality and safe patient care. And number two, we want to demonstrate professional identity and integrity, and medical educators are expected to uphold the high standard of professionalism and integrity within their own work. That means honest, transparency, accountable, and consistency of demonstrating a commitment to ethical behavior and the values of the profession that it so serves. And number three is commitment to a scholarship and reflection. And that's demonstrated within some of the self-reflective essays within the application process, because the Academy really values a scholarly approach to medical education. So that means engaging and keeping abreast, sometimes with the educational research, best practices, and application of this knowledge to improve teaching and learning as well. And number four is the demonstration of respect for others. Medical educators, as medical educators, really we create an inclusive, respectful, safe learning environment that can value diversity, promote equality as well. And as we do already within best practice, that means showing respect for students, for colleagues, for patients, and other stakeholders as well. Now, one of the things to bear in mind is the fact that I won't go through all of this with you here, but if you want a more detailed exploration of the core values, I'm going to encourage you to refer to pages 9 to 10 of the Academy's Standards booklet. And this section provides a good comprehensive overview of each value and offers clear guidance on how you might want to demonstrate them within your own educational practice, and lists some examples there. Now, in addition to these four values, there are other things, the 5 key domains, which are organized here in red and circled in red here. So design and planning of learning activities, teaching, assessment, educational research, educational management and leadership, and each of these domains represents a key area of competence for medical educators and the professional standards, and provides a really detailed guidance on the knowledge, on the skills and behaviors expected at each different levels of attainment. And we can explore that here. So to expand a bit further on, the design and planning of learning activities, which focuses more about the ability to design, to plan effective learning experiences that are aligned with the intended outcomes, how to engage learners, how to promote deeper understanding. And that you may demonstrate skills such as curriculum development, instructional design, the use of appropriate teaching and learning methods. The second one, teaching and facilitation of learning, encompasses the actual delivery of teaching and the facilitation of learning in various settings, whether that be lectures, small group sessions, clinical teaching, online environments as well. And number three is the assessment of learning, which covers the design and implementation of the assessment strategies that needs to be valid, reliable, and are aligned with the learning outcomes. And that can include both the formative and summative assessments, or the provision of constructive feedback as well. Number four, educational scholarship and research. And this domain really recognizes the importance of engaging in research and scholarship to advance the field of medical education, and includes activities such as doing research studies, presenting at conferences, publishing in peer-reviewed journals, etc. as well. Number five is educational management leadership, and this really focuses on the management skills required to oversee, to improve educational programs and initiatives, and that might include skills that you might want to demonstrate, such as quality assurance, resource management, program evaluation, or the ability to lead and inspire teams of various educators. And we can see from Jody, a full PDF of the professional standards is available on both the Academy's website and also within the chat box now. And I really advise you to just download it and review that in detail when you write your reflective practice. Now, as you open up some of the PDF in the future, as you write through some of the reflective essays, to give you a sense of how it's structured, I'm going to take a snapshot of domain one, which is design and planning of learning activities. And we're going to do that for one domain. And the standards provide a really detailed descriptor for each of these domains at 4 different levels of achievement, ranging from level 1, which is entry level, to level 4, which is expert. So as an example, at level 1, an educator might be expected to contribute to the design of a learning activities within an existing course or program, or with guidance from more senior experienced colleagues. At level 2, as it steps up, they might take more responsibility for the design of the learning activities within the course, ensuring alignment within the intended outcomes and the needs of the learners. And as you progress to level 3 and level 4, the expectations become much more advanced, with a focus on leading the design of innovation and evidence-based learning activities, and contributing to the development of new approaches and policies, perhaps at an institutional or even national level at the expert levels. And the levels are used by the Academy when the assessors come to take a look at it in helping to determine whether to award membership or fellowship levels. And the achievement is demonstrated by fellows generally exceeds level 2. And significant achievement tends to be always at level 3. However, it's obviously recognized that not all fellows will achieve each element in the domains at every single level. Now that we've covered one of the key components of the professional standards, I'm going to turn your attention to the application process itself before I hand you over to John. The requirements for each membership categories vary, but I'm just going to be focused on the fellowship route, which is on the far right-hand side. And for fellowship route, there are 2 routes available. There's the broad route and the specialist route. We have always strongly advised against using the single domain, the specialist route, and we continue to do so because we expect all applicants to be able to submit an application addressing achievements in all the domains, which is the broad route. And the broad route is the most common route available, and that's the one that's recommended for pretty much all applicants, and would require you to demonstrate achievements across all 5 domains of the professional standards, and for which you can do so by providing 5 250-word reflective statements, each of these mapped to one of the domains that I've highlighted, showcasing your expertise and impact in those areas as divided by the different levels of the domain. Now, I'm not going to spend too much time on the specialist route, as we do recommend the broad route application, and we strongly encourage applicants to follow that advice. The broad route is the way forward. The fellowship application should also include the following: a 500-word reflective statement on your own professional values, highlighting how your perspective and approach through the view that you take, through the lens that you view the world, has evolved since you first joined medical education or the academy. We would also like to have a reference from a medical educator who can speak to your achievements and contribution as well. And there should be evidence of CPD within medical education, perhaps in the last 2 years, that can demonstrate commitment to learning and growth as well. There can be a very quick record of a peer review of your educational activity. So that provides an external perspective on the quality and the impact of your work with the learners themselves. And a very short reflective piece, which is around 250 words, on the peer review process and how that might have informed your own practice. So you'd want to use the peer review and reflect on the comments that your peer has left for you, and how that might jumpstart or jumpboard your future commitment to medical education. So as you can see, this application process is rigorous, it's comprehensive, and it really allows you to showcase the breadth and depth of your achievements as a medical educator. And it really allows you an opportunity for deep reflection and self-assessment, hopefully helping you to identify your strengths, your areas of growth, and future goals through this exercise alone. And in the upcoming sections of this webinar, I'm going to hand over to John shortly to explore some other strategies and tips for crafting effective reflective statements, hopefully mapping your achievements to the professional standards, and also contributing, or presenting the case for fellowship. And then finally, John will be there to answer any questions that you might have and share some insights on what makes a successful application and answer any specific questions. So with that in mind, I'm going to hand over to John now.
Okay, well, thank you very much for it. Can I have the next screen then, please? Thank you. So for what we want to try to do is to try and understand what you do, why do you do it that way, and perhaps what you're going to do differently next time. That certainly is what are you going to do next time, highly important for the reflection on the peer review of your learning. So what we want to do is for you to be thinking. We want to try and get inside your mind. What's your rationale for doing something in a particular way? So if you begin to describe assessment, what do you actually do? Rather than a CV saying, I was an examiner, at a fellowship level, we expect you to be working at level 2 and certainly ideally at level 3. And that is where there's much greater responsibility about designing questions, reviewing questions, assessing and evaluating the questions, whether the learners have met the outcomes, and if not, what are you going to do? And what we'd like to try and get is a feel for how you've actually gone through that process as a medical educator, because people tend to describe what they've done, very little about why they've done it that way and what are they going to do next time. So, for example, how did you teach or support learners in this activity? How did you come to use it? Was it based on a feeling? Was it based on best practice? Was it based on a research study? How have you made that decision? Was it going to a conference? It doesn't necessarily have to be a specific reference, but why have you decided that you're going to say teach in a particular way? Why do you think it was successful? And how do you know it's been successful? So how are you beginning to measure it? So ultimately, we want to try and understand how you justify your work as a medical educator. Next one, please. And particularly what we've been keen on is to try and understand how you've used your knowledge, because people have been on courses, particularly for membership. How have you learned to apply the learning theories, the models, the literature that you read, the courses that you've been on for CPD? How have you applied that information to your teaching and learning practice? And a common reason why people are unsuccessful at in their initial time when they submit a fellowship assessment is that there isn't sufficient information to look at how each of the elements which are within one of these domains has actually been met. So it's not just about the depth of information, you're also interested in the breadth across all the topics. And if you look through those elements, so what usually happens is that we will ask the applicant to actually provide more information, and we mark it as being insufficient information to make a choice. But also, do particular core values relate to it? How have, for example, equality, diversity, and inclusion being applied to teaching and learning? Next one, please. And basically, reflection is we do something, we observe and make some thoughts about what we've done, we think about it, and then we plan to do it again and what we've learned from our experience. And for me, the hallmark of any professional is this cycle, where actually we use our insights from one situation and use it into another situation, what worked well, what didn't work so well, so that we progressively improve ourselves as professionals and in this particular context as educators. Next one, please. And if you look at this one example, to what extent do we feel that this is reflective? I'll give you some time to read through it. Now that gives a rationale, gives some justification. We'll look at example 2 now. Next slide, please. The next slide, please. Thank you. You can see there. This is a slightly different way of reflection. But actually, it starts to look at and justify with evidence about what they're doing and why they're doing it that way. Next one, please. Slide, please. We have examples there's a members to Fellows handbook, which is on the website and is downloadable. There are examples there and further hints. The commonest pitfalls is that it tends to be a description, a list, a bit like a CV. This is what I did, this is what I didn't do. And it lacks critical reflection. We also expect that there is evidence of scholarship, which is about justification of why somebody is doing something the way that they are. Is it down to doing some previous research, their experience? Is it down to talking to a world expert? Is it based on looking at best practice guidelines? Is it based on going to a CPD course? Is it based on a particular reference? And that gives a rationale for the educational approach. Another area is that evidence may not be sufficiently recent. And what we really like to see is that there is evidence that all of the domains and the examples are in the last 3 to 5 years. So it's current, but we recognise that sometimes that can be difficult in one particular domain. But for fellows, usually most fellows will have a broad approach. Sometimes there is an incomplete application where the domains are missed out completely. And we've put there about the specialist route, again in the handbook and on the website and in all the information, it says that this is really exceptional. So we are expecting people to be providing evidence across all of the domains, all 5. Next one, please. Again, people tend to describe that they have core values, but do not give an example of how they apply those values in practice. If people have done CPD, how have they actually used that? We also ideally like applicants to structure their answer logically, so that first of all, it is within the domains, the relevant domains. So in other words, if somebody's talking about assessment, it's not in the teaching and learning or leadership. But also, it does help that when it helps the assessor, it also helps to ensure that you provide all the evidence, is to go through the elements within each of the standards. What we're particularly interested in at fellowship level is the impact, not just on learners, but having support to others, particularly junior colleagues. And if you look at some of the elements, there is greater responsibility, because just like any fellowship of the other colleges and academies, it's expected to show, applicants are expected to show a high level of professional role within their area. So as a medical educator, we would expect that you would be supporting juniors, not the learners, but junior colleagues, to support, say, the development of new teaching or assessments. So you're taking a much more leadership type of role. Also, people do tend to talk about what they do clinically, and that their research is all clinical, that they quote. So it's important that the focus is on educational achievements. Next one, please. And there has been this dilemma of broad or specialist route. At the moment, over the last year, everybody that has applied for specialist route has been advised because if applicants who apply for the specialist route are automatically seen by two independent assessors, and both of them have agreed that a broad route is much more appropriate, because the specialist route, actually, we are looking at higher levels of achievement, 3 or 4, and we have not been able to identify colleagues who've done an application within a single route only, who have been at those particular levels, because they are doing other activities. So when we've asked for further information, they've amply demonstrated that they have had broad experience across all 5 domains at appropriate levels. But also, it's a specialist route for exceptional circumstances. Next one, please. And there are some tools which help you to think about how to reflect a little bit easier about thinking what you do, when you've done it well to, how often, how long, how it maps against the standards, and the various activities that you do in day-to-day educational practice. Try thinking about it, because it's surprising. People do have a whole range, even if somebody predominantly doing management and leadership at, say, a dean of a medical school, it'd be very unusual that they're not involved with being involved in planning assessment, so, or taking an oversight for assessment, or taking some oversight for teaching and facilitating learning, or designing and planning learning. So it's not just about leadership. It's all, they are involved in other aspects. And they also are able to express their core values, not just in their role as a leader, but also in the institution in which they are the leader. So some of these types of views are useful. And as I said, there is the membership to fellowship application handbook, which is available to everybody, which gives some examples in that. Next one, please. And also referees. Referees should give a reference which supports you. Sometimes they write entirely a clinical reference, based on the applicant's clinical activities, give very little about medical education. Also, sometimes that the reference does not include the breadth and depth across all the domains. What we use it for is to say and just check and get somebody else's opinion to support what you are saying. It's useful to write in the first person an active sense. This is what I do. This is occasionally people write we. You see this sometimes in PhDs. It's your work. It's what you do. So we're keen you to be able to do that. And really, it's important to cover all the dimensions and all the elements, and to carefully read through the criteria which is in the professional standards. Try and keep things recent. Remember, what did you do? Why did you do it? And what are you going to do next time? And be very explicit about what you do. People tend to be vague. They tend to undersell themselves. They say that they are involved with OSCEs. But what do they actually do in the OSCE? Do they just sit there, act as an examiner? Do they construct questions? Are they part of the standard setting? Do they design something so that they're involved in developing a new course? What was their role? But be really, really explicit, and particularly emphasize how your initiatives have been evaluated or changed practice. We always think for fellowship about the length, breadth, and depth of your activities. It is unlikely that an applicant who has been involved in medical education will be of the appropriate standard for fellowship if they've only taken a role for 2 to 3 years. They may do, but often there is insufficient length of experience to be able to demonstrate the breadth and depth of the activities and their influence. We would recommend, therefore, that the applicant applies directly for membership. Next one, please. So I hope that information was useful. I'm sure you've got lots of questions. And I'll be delighted to answer something, so will Phil and so will Nick.
Excellent. Thank you very much, John, for that very useful section of the webinar, highlighting the self-reflection